Hello, everybody. This is Dr. Hamid Elmir. I am an MD, MPH. At this podcast, I sit with the world's experts in health education and community development to talk about current health challenges and ask them to share their experiences, knowledge, and thoughts with the people of Afghanistan and other developing nations so that they can learn from experts across the globe. I have two amazing guests today who are health experts and Fulbright scholars. Without further ado, I'm going to introduce each of the speakers and pose a few questions on the current situation in their countries, how they have managed it, and share their experiences with people and health professionals in Afghanistan and across the globe. Welcome, Dr. Jaber.
Hello. Thank you, Dr. Hamid, for this invitation. I'm really happy to be here.
Thank you for having us, Dr. Hamid.
Thank you. Jaber Belkhiria is a Tunisian national and holds both a public Master's in Preventive Veterinary, which is DVM, and a Ph.D. in Epidemiology from the University of California, Davis, as a Fulbright scholar. Dr. Belkhiria has been working on modeling emerging diseases such as Ebola, avian influenza or the bird flu, and coronaviruses. He earned extensive expertise in managing health and research projects in West African countries like Senegal, Sierra Leone, Guinea, and Liberia. Dr. Belkhiria is currently based in Tunisia, from where he manages his work. Dr. Belkhiria, welcome to the show.
Thank you very much.
I'm going to start with you and posing the questions that I'm pretty sure this is going to help us to learn from one another and to see how is the current situation and pandemic of COVID-19 going in Tunisia.
Right.
So the very first question, Tunisia's healthcare system is a fragile and yet it has coronavirus under control. What did Tunisia do differently to control coronavirus as opposed to other countries with fragile health systems?
From what we know from COVID-19 right now is that it affects elderly people and other people with non-communicable diseases. And with regards to that, Tunisia has the oldest population in terms of age in Africa. It's still younger compared to Europe, but it really plays a role with COVID. Another important point is non-communicable diseases, and Tunisia is we're seeing basically the prevalence of diabetes, obesity, and other cardiovascular disease increasing in Tunisia. We are also not familiar with epidemics. The last one happened in the 1800s. It was a cholera outbreak, and we were put in confinement. The healthcare system in Tunisia is considered the second best in Africa. We have a well-trained healthcare workforce, right. And we are also providing help in terms of health for neighboring countries such as Libya, Algeria, and other West African countries. The health workforce in Tunisia is being brain drained to European countries such as France or Germany, but also to Canada, UAE, Qatar, many other countries. In terms of infrastructure, it is really important to notice that there is a kind of a disparity between the public and the private sector. The infrastructure is modern and very well developed in the private sector. However, the capacity is higher in the public sector. And then in terms of geography, the coastal areas are more equipped and better prepared than the central areas of Tunisia. And that all affected the strategy that Tunisia took with regard to the strategy against COVID-19. Right. So, for example, Tunisia chose to have a centrally managed response. Right. and for that reason, the president and the higher government, the head government of Tunisia, put all power necessary to tackle the disease, and they even reduced the bureaucracy that we have in Tunisia in terms of decision making, and they empowered the Ministry of Health and all the leads in terms of health to take faster, rapid, more efficient decisions. One thing that we all agreed on in Tunisia is the the proactive measures that the government took even before the appearance of the first case. So there was a strategy already put in place, and stakeholders knew what to do. Okay, even before the first case, which happened in March 2nd, right? As soon as the first case appeared, we closed the borders, I think on March 16th, so probably 2 weeks after the first case. And then we went into an early confinement on March 20. We basically recorded 24 cases, and the government rapidly decided to have everybody at home. And we added a curfew as well. So from 6 p.m. to 6 a.m., we were basically obliged to stay at home.
A very quick decision and timely.
Absolutely, yeah.
Mm-hmm.
And I mean, overall, that really helped to reduce the number of cases in general.
Great. So thank you very much, Dr. Jaber, for the informative discussion. And I'm going to follow up with this question in how Afghanistan can learn. But before that, I'm just going to briefly also introduce our second guest today. Dr. Osama Zikri is a Tunisian national and a global health consultant. He is a DMD, or a dentist, and holds a Master of Health Administration with a focus on health policy and management from the University of South Carolina as a Fulbright scholar. Dr. Zikri is currently based in Kingdom of Morocco and works on the development and management of disability programs in West and Central Africa. Prior to this, Dr. Zikri worked on technology-driven solutions and implementing health development projects in several African countries, from Senegal to Burkina Faso, Benin, and Madagascar, to only name a few. Welcome, Dr. Zikri.
Thank you very much, Dr. Hamid. Thanks for having us.
Thank you for your time. I'm going to follow up and what Dr. Belkhiria just mentioned about the Tunisian management and health, how they were fighting COVID-19. I would pose this question to you. How can Afghanistan learn from Tunisian experience and model?
Good question, Dr. Hamid, and thanks for my friend and colleague, Dr. Jaber, for presenting the context in Tunisia. I would start first by putting an emphasis on considering the fundamental differences in the context of each country between Afghanistan and Tunisia. However, at the same time, in regards to COVID-19, we are fighting the same enemy, the same virus. This enemy is novel to the world and also novel to Tunisians and Afghanis alike. So I guess there are some lessons to be learned from the Tunisian response, which I can summarize in 3 major points. The first one is the decision to dissociate politics from science and from the strategy itself. And like many other countries, we actually in Tunisia posed our political disputes between national stakeholders, and we decided that we're gonna objectify the response around scientific and evidence-based measures only. Second, the ability of decision maker and health policy makers in Tunisia to adjust their response according to the elements of the health crisis. I would mention specifically building on existing response strategies. You have to have a plan ready before the onset of the outbreak. You have to also define the role of each stakeholders in the strategy once you start implementing and unfolding it. And lastly, build on that plan, reinforce successes, and adjust on the move. Another sub-element would be showcasing flexibility. Jaber talked about minimizing bureaucracy, which gave health policymakers the ability to alter their response processes and seek greater agility. And finally, having a strong institutional backup. Here, I'm talking specifically about the coupling MOH, the Ministry of Health, with the National Observatory for Emerging Diseases, which is formed by Tunisian scientists and public health experts, as well as epidemiologists who can provide technical backup to the leadership, to the Ministry of Health leadership. I will also mention reputable institutions and how it's necessary to engage them in the strategy. I think of the Institut Pasteur in Tunis, especially its role in the testing strategy or in testing in general for COVID-19. And finally, the final lessons would be seeking public engagement. You know, Dr. Hamid, when we talk about public health programs, we talk a lot about population-centered design. So I think it's crucial to have the buy-in of the public for the success of the strategy and the response itself. I will summarize it quickly in four points. Explain thoroughly, decide quickly, engage the public, and reinforce the loop. So that you see, can you gain you find a better outcome out of it. Let's not also forget about supporting the most vulnerable as we tackle those issues and try to contain the virus. I would say that these are the main lessons that can benefit Afghanistan and the Afghani decision makers when it comes to containing the COVID-19 epidemic.
Dr. Oussama and Dr. Hamid, I wanted to highlight that I really like the question. This is an interesting question, and I wanted to point out that we are all learning from each other.
Absolutely.
Because as Dr. Oussama said, this is something novel, and we are looking at different experiences all around the world and seeing what might fit the best or adapt these scenarios to what fit the best in each country. So, for example, we are learning from your podcast as well, and we are learning from other people's activities towards COVID-19 epidemic.
Well, great. Thank you so much, both of you. This was very informative, and as you guys mentioned, it is this pandemic actually is new for everyone, and it's unprecedented. The transmissibility of this virus is really different than the ones we had before of coronaviruses. That puts everyone, every situation, every country, and every nation at risk and vulnerability. So we are trying to learn from one another, and the whole purpose behind this podcast and also the shows that I have is also to bring people to people so we can learn from one another across the world and share our experiences. Thank you again for mentioning that. Just following with Dr. Zikri, that you mentioned about how the Tunisian government and also you mentioned also somehow the private sector also took part in fighting COVID-19 back there. So let me ask you this question. Tunisia's health services are mainly provided by the public sector. Was this helpful in fighting COVID-19, or do you think the privatization of the testing centers would be also better?
Yeah, I think we have to clarify one point. At least in my opinion, the public health, the public institution, public hospitals played a big role and an important role in this response for sure. But I think the fact that the outbreak was considered a national security threat by the government and that the government leadership opted for a centralized response made public institution a de facto important player. However, Jaber mentioned this earlier. It's true that 87%, for example, of bed capacity in Tunisia is provided by the public sector, but we shouldn't forget that the public health infrastructure in Tunisia is aging since years now. And there is a disparity in the affordability of healthcare services, but also in the geographic distribution and access to these services. And here comes the benefit from engaging the private sector, in my opinion. We all know in Tunisia that the private sector has been the premium choice for healthcare services among Tunisians for many years now. In the private sector, we find more advanced capacity to take care of patients, and at the same time, they have a strong and organized lobby to back them up and to lobby for their inclusion in the strategy containing the virus. So no doubt, in my opinion, yes, the public sector is important, but there is no doubt that mixing care and engaging private sector in the response will strengthen our strategy and the response itself. However, we should make sure that equitable access to private and public services alike is guaranteed. Dr. Hamid, it's also noteworthy to mention that the need to engage the private sectors goes beyond the sole provision of care to other sectors as well, which are also affected by the epidemic and also trying to contribute to the containment of the epidemic. I think of the hotel industry, for example, stepping in to provide space for quarantining patients. And we think also of the food industry providing meals during the crisis, the health crisis, to essential workers, and many other private players joining the national effort to contain the outbreak in Tunisia.
Well, great. Thank you again for mentioning all these important key aspects of how to manage the crisis of this pandemic at this time. And you just pointed to a very key important part, that was how public can also take part during this time. Like any gesture is really helpful and encouraging, especially the health professionals. You talked about the hotels and restaurants, and there are examples across the world that how people stepped up and helped the one another, basically providing food to the health professionals and encouraging them and appreciating their work. There are examples across the world, and Afghanistan also. I read the tailor who was just an ordinary tailor, and he was working from home or at his shop just for living. And after he learns about that there are people who they don't have masks, and he starts making masks with the little machine that he has, the sewing machine, and he made like 6,000 masks and distributed to people just for free.
Impressive.
I'm pretty sure there are examples across the world, and it really is the time that people should come together.
Yeah, I think this is really important to know that health is not just hospitals and medicine and vaccines. Everybody could contribute, and as a matter of fact, I know in Tunisia that a lot of engineers or student engineers were creating face masks, for example, for healthcare workers in Tunisia, or I think in Morocco or other parts of Africa as well. There were a lot of masks manufacturing and even media, sometimes creating spots or radio channels just to help people understand the importance of protective measures. It helped a lot.
It really does. So while I have you here, Dr. Belkhiria, let me pose this other question from you here. How helpful was the Tunisian containment policy? First case was, as you mentioned, on March 2nd. Quarantine self-isolation started soon after the first case. Are people abiding by the public health directives?
Let me tell you that we are not in confinement anymore, and this happened probably 3 or 4 days ago. So on May 11, I think, and as you can see, I got a haircut. So it was one of the exactly, and in a way, one could say that. One of the important factors that helped Tunisians, help with these restrictive measures was seeing what was happening in neighboring countries such as Italy or France. So that helped a lot to have people comply with confinement and curfews and other measures. That was the first thing. But then it's not a matter of complying; it's also sustaining it. Right, as you know, sometimes confinement or curfew lasts for weeks and months, right? And then the first week might be easier than the second, and the second might be easier than the third, right? So it is the government that has to understand sometimes the social situation that the population goes by, and then understand that people need a job, need money, need food, and try to respond to that. And that's where where the social sciences and social scientists play an important role, right?
Mm-hmm.
And then in terms of how Tunisia did, I mean, from an epidemiological perspective, in terms of number, we can say that, you know, it worked out pretty well. We were able to flatten the curve, right? And we were able to reduce the number of cases. Now we are at 0 case for 5 days in a row, which is amazing.
Congratulations.
Right?
That is great.
Thank you very much. But I mean, it's not a reason as well to stop, you know, using protective measures and being careful. That's really important, right? And then our healthcare system. So in Tunisia, we have 500 ICU beds. They didn't get overwhelmed, which is fantastic, right? So we succeeded.
Yeah.
Now, if we look at the dynamic and how this happened, of course, you know, we could have done better, and it's a learning experience. So, for example, the government relied on people's goodwill to self-quarantine after at the beginning, when they first arrived from Europe or from other areas, from China that have been endemic for coronavirus, and people failed to respect self-quarantine, right? And that led to more and more cases, right? Another important factor, which is providing protective equipment for frontline workers, right? That came late, and that caused many cases in our valuable healthcare workers, right? And that could have been avoided. And then one. Sorry,
here.
Go ahead.
You just mentioned about this while you follow up with the first question. You pointed out also to the PPEs, or the protective equipments, that is that you acted, or the Tunisian government acted later. We also have the same challenges back in Afghanistan, and unfortunately, you know, a country where economically it's not stable and depends on the international support. We unfortunately lost already 10, 12 health professionals, most of them doctors.
Right.
I don't know, partly it was the reason maybe we didn't have enough PPEs, and there could be other reasons.
Yeah, it's a really complicated problem to solve, I think, especially when in our countries sometimes, and not just in our countries, to be honest, right? And we've seen this happening in a lot of developing countries and a lot of developed countries. It's something that everybody had to face, the shortage of protective equipment, and it's a lesson to learn for the future, right? Another important factor that could have helped was seeking help from or looking at experiences or allying with other countries to help with this global health issue, right? And perhaps Usema, you can probably comment on that.
Yeah, absolutely. I mean, Jaber touched based on an important point, in my opinion, which is seeking outside experience, or exchanging outside experience to combat the epidemic. Let me remind the audience that Tunisia is in the middle of a democratic transition for almost a decade right now, and at the same time, it's a country not familiar with epidemics and communicable diseases in general. So we could have done better for sure, and we should be able to do better. And one important elements or tools to do better is to seek outside experience, to strengthen our regional and international collaboration with the reliable stakeholders. I know that Tunisia collaborates with multilateral institutions like the World Bank, the WHO, which is very important, but we should also seek regional expertise, and it should be something that we work on it actively, and we can involve our diplomacy in it. I think of CDC Africa. I think of collaboration with the African Union, African Development Bank, and many other regional stakeholders that could help. From an internal perspective, from within the country, I think we should do better in terms of like conducting retrospective assessments. Unfortunately, this is a pain point in Tunisian public policy or Tunisian decision making in general and for many years. I think there would be time that we need to go back and reassess the response and the results and the different factors involved in the outcomes we have, be it good or bad, and we need to draw the right conclusion from there. And most importantly, we need to revamp our emergency response capacity and preparedness. I think of the National Observatory of Emerging Disease, which is supposed to be a CDC-like institution, but they for sure need more resources, human resources, financial resources, and more prerogative on the ground to implement strategies and enforce them, most importantly.
Mm-hmm. Well, great. Thank you again. While I have you here, Dr. Zikri, let me just ask you this final question. How do you see the pandemic's socioeconomic implications in Tunisia?
I would say that Tunisia, like many other countries in the world, the future is uncertain for sure. We've touched based on the necessity to support the most vulnerable population of the society during the epidemic. Let me also mention that the Tunisian government, the current Tunisian government is a newly elected one. They picked up work in 2020, and they already had so much social pressure from years of a democratic transition and fragile economic situation, which will probably get worse. According to the World Bank, the Tunisia's economic growth is projected to contract by 4%. We have already been struggling with low single-digit growth rates. So I think here that tough years are ahead for a fragile transitional economy, like any other fragile transitional economy in the world. There will be a strong contrast between social pressure and liberal trends when it comes to government decisions, and also the government itself will be under test because they provided electoral promises socioeconomically, and they need to implement them, and they need to succeed in the reforms they promised. And it's going to be a very difficult task, I think, for the government and for the population alike. However, at the same time, I want to end on a positive note. I think the outbreak is still a valuable opportunity to engage in deeper institutional reforms, highly anticipated by the Tunisian population, and rethink the way we do business post-COVID-19. Already the Tunisian mindset and Tunisian minds started to adapt to the situation, and we are glad to see several innovative initiatives sparking out of the outbreak. These should be sustained by strong government leadership, willing to engage in a meaningful economic and fiscal reforms, in my opinion.
Well, great. Thank you so much, both of you, for the sake of time. We had a lot of questions, and I was actually gathering a lot of questions from people, but we would definitely also continue to have you both on another show, and definitely we will talk more about it to learn from one another. And this is really a great opportunity for all of us to learn from one another. And thank you very much for sharing all this experience. I'm pretty sure that Afghanistan, especially, and maybe other developing nations who are behind Tunisia in terms of the curve of this pandemics, they can learn from the steps that you guys already been through. And thank you so much. We have just a couple more minutes. If one of you, I know that you also started Open Naqash, and could you just briefly, maybe a minute or two, talk about it?
Yeah, I mean, just briefly, we mentioned that during this pandemic there were a lot of initiatives, right? From youth, engineers were making masks, and people were helping feeding health workers and hosting them in hotels and whatever. And we decided, why not to help with our background and our experience in health as public health experts. with our expertise in West Africa and Central Africa and dealing with these kind of diseases, we grouped ourselves and we decided to write first to explain to Tunisians in a very easy words all the technical, advancement that has been happening from testing, vaccines, treatment, but also explain some epidemiological concepts that have been, exposed in the media recently. Against fake news in social media, and that's what we decided to start writing, and we are progressing these days, and we are always looking for people to contribute and help. It's very exciting.
Yeah. Thank you so much. Thank you for sharing about Open Naqash too. Of course, that is a great initiative, and that's why these shows like mine also is trying to bring people together and learn from one another, as I said. And it is basically just from people to people, so we can learn from one another. Thank you again so much, both of you, Dr. Zakri and Dr. Belkhiria, for your time.
Thank you very much. Thank you for having us.
Thank you.